Good morning and good day to everyone. Hi, everyone. It's wonderful to have you here with us as listening in. I'm Emerentia du Plessis, and I have the privilege of interviewing Professor Welma Lubbe. She is the Acting Research Director of the NuMIQ Research Focus Area as from February 2022. Welcome, Welma, and we are so interested in hearing to what you are saying.
Thank you, Emerentia, and thank you for the invite. We're looking forward to share with you what we do in the unit this year. So that's exciting. Thank you for that.
Thank you so much. And let us start with that. And please tell us, what is your vision for the NuMIQ Research Focus Area for this year?
Thank you, Emerentia. Yeah, this happened quite suddenly. It's not really something that I planned for the foreseeable future. I was actually focusing more on my own research, but since the management asked me to act in this position, I thought a little bit about it, and I think I'm going to do some things that I've been busy with in the past as well. So in 2021, we started a new model for our new students that we take in. So we started a way to guide them a little bit more in a structured manner so that they have more deadlines and they can plan their work better. Because I think one of the things that a postgrad student struggle with is to actually stay on time, realize how quickly time flows when you are busy with your postgrad studies, and then life happens, and then things get postponed and they take very long to finish. So I think one of the important things is for us to try and stick to timelines and help supporting the supervisors so that they don't have to worry about the timelines, that we from the office side can actually worry about that and help students to stay on track with their timelines for their postgrad studies. So that's the one side. And the other side is we have wonderful staff in the NuMIQ unit and a variety of skills and knowledge as well. And we have stronger researchers and we have novice researchers. And I think we're one of the units that's very privileged because we were very fortunate that nursing now for the third year have a postdoc position. And I supervised the postdoc, and it was the first time that our unit actually got this postdoc. So, and that just made me realize we need to invest in staff and we need to develop so that people can actually develop as researchers. And a lot of our own previous students, alumni students, actually wants to become researchers. And I think that's interesting and that's exciting. And I think that's something that need to develop. So I think we need to develop more into a culture of nurse and midwife researchers. And I would like to support the staff to identify their own growth in this environment and how they would like to develop and where do they see themselves in a few years' time developing as researchers.
Wonderful. I so agree with that. We need a structured timeline that will be very helpful. And also I'm excited to hear about the vision to develop researchers, nurses as researchers, because we need that and it will have an impact in nursing practice to improve quality of care.
I think so, yes.
Please also tell us more about your own research accomplishments. Last year and the years before that was a very productive years for you as a researcher, and you have pick the fruit of that now. So please tell us more about your accomplishments recently.
Thanks for asking, Emerentia. So yes, I love babies. Everything to do with babies, but specifically premature babies, and then their parents and the staff that work with them. So my research area is neurodevelopmental supportive care of premature babies. So that is the care model that we have to support the babies when they are in the hospital and then early after discharge. So I was fortunate when COVID arrived that we could actually do an article on COVID and breastfeeding in the neonatal unit environment. So that was wonderful. It was a bad time in all of our lives, but it gave us the opportunity to take the knowledge that we have, write it up in a format that we could actually distribute. So we could send on that document with some guidelines and a flow chart on how to go about. And the bedside nurses and healthcare staff could use that. And I think that for me is exciting about research. It's not something that gathers dust, it's sitting on a shelf somewhere, but it's implemented. It's quality improvement, like you've mentioned earlier. So yes, I've done that, and then I was fortunate that my article publications came bunched in a year or two. That's always the way it works. You don't have the same amount every year. And I had wonderful co-writers, which I think is also very important. So all of that then added up. My research spoke to my teaching in the undergraduate environment, and it also spoke to the community involvement. And then I'm involved with some of the private hospital groups as a facilitator or as a consultant. And I've been invited with the National Department of Health on some of the focus areas on neonatal development and so on. So that's exciting for me. That's nice because we can work in a place where we can make a difference. So the students that work with me also focus on babies, not only preemies, but more babies and breastfeeding and so on. And that's nice because they take this and they go back and they really make a difference. And that for me is exciting. It's not, also their work is not just something sitting on the shelf, and that's fantastic. So yes, with all of that, I was fortunate to fit the criteria for, what's the word? Thank you very much, rating as well as promotion, sorry. Yes, so I was promoted to full professor, and then I also was very fortunate to have a C1 rating with the National Research Foundation, the NRF. With the C1 rating, there's international recognition, and that's quite a nice level of rating to get. So for me, it's special because I work with people abroad, and I've met such wonderful people in my life, and they all build into my professional life. And that is recognized by peers. So for our staff, I think going for writing, it's a lot of work. And the question is always, why do it? What's in it for me? But just that knowing that you are really an expert in the area where you work. I think that's something any academic would like to work towards. So I think that's something that I would really like to recommend. And I would like to ask our colleagues to consider going that route, whether you're young or older, but plan your research program and your research progress according to that. For our students, why do you do the research? Why do you want to do it? Do you just need that degree to put it on the wall? Because that's not going to make a difference. Or do you want to do research where you can really go into practice and make a difference? For me, if I get feedback from the hospital when they say, okay, so we've done this training and we're part of this research project, and these are the outcomes that changed. The mums are more involved. Our babies are not that ill. We can see that we can manage them better. With our community project, the Starfish project, if the department gives us feedback and say, we don't see babies anymore dying of malnutrition, then it's, wow, that made a difference. And I think that's why we're academics, and that is why we are involved in research.
That's so inspirational. Thanks for sharing that, and thanks for all your contributions. It's really making a difference.
Thank you, Emma Renshaw, and I'm looking forward to work with this team. I think my predecessor, Prof Karen Minnie, did a great job bringing the different campuses together. I think within nursing, we're really one of the schools that work across the borders of the province, and that for me is very exciting. And I'm also very excited about the different components and the different focus areas that we bring to nursing and midwifery. So I believe that if we continue like this, then the Northwest Province, nursing and midwifery will really be a beacon in this country. And I think we must just all keep it up. So thank you for having me, and good luck to all of the partners that we have at the NuMIQ Research Unit.
Thank you very much, and all of the best.
Thank you.